Salam sejahtera, ya.
Wabarakatuh.
Namo Buddhaya, Om Swastiastu, salam kebajikan, Rahayu. Oke, Bapak Ibu sekalian, ESP Teachers se-Indonesia atau di dunia nih ada juga. Selamat datang di acara kita pada hari ini, ya. Dan kita akan memulai sesi pertama, ya. Karena sudah lewat 9.30 nih kayaknya, 9.36 ya. Ini 24 partisipan, oke. So, saya akan membacakan bagaimana rundown-nya. Nanti kita mulai, kemudian akan diikuti oleh National Anthem yang akan dipimpin setelahnya itu oleh saya, ada photo session, dan kemudian welcome speech, diikuti dengan presentasi dari speaker 1 dan speaker 2. Kemudian setelah itu question and answer, dan ada nanti terakhir kita ada announcement untuk the next session. Oke, sekarang saya buka session ini dengan mengucapkan lafaz basmalah. Bismillahirrahmanirrahim. Oke, sekarang kita masuk ke sesi berikutnya, yaitu adalah mendengarkan National Anthem, yaitu lagu kebangsaan kita yang akan dipimpin oleh Bapak Ari. Silakan untuk itu.
Okay, thank you very much for the time. So I would like to play the national anthem of Indonesia Raya.
Mas Satria masih muted.
Sorry. Thank you for the song, Mr. Ari. Yeah, it relieves our nationalism, I hope. Yeah. So today, after the national anthem, yeah, next session is the welcoming speech from the vice chair of ESP for Mr. Dwi Nugroho. The time is yours.
All right. Thank you very much, Pak Satria, for the time. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Good morning, everyone. On behalf of the Indonesian ESP Teachers Community Board, I would like to warmly welcome all participants to ESP Sharing Session number 17. And thank you very much for taking the time to be here with us today. In this exciting session, we will specifically explore English for specific purposes, ESP, in the nursing context. We are honored to have Bapak Dr. Ahmad Kailani, Master of Applied Linguistics, and Ibu Solis Setiyani, S.Pd, M.Pd, who will share their valuable knowledge and experiences in teaching ESP for nursing. Therefore, I would like to express my sincere gratitude to Bapak Kailani and Ibu Solis for their willingness to be our speakers today. I would also like to thank Bapak Satria Adi Pradana, M.Pd, who will be moderating this webinar. May Bapak and Ibu always be blessed with good health and continued success. I would also like to invite all participants who have registered as the members of the Indonesian ESP teachers community to actively take part in our future ESP sharing sessions, either as the speakers or moderator. Our community organizes regular webinar activities every 3 months, Bapak Ibu. Each year, we typically hold 3 sharing sessions, usually in January, July, and October, and 1 expert sharing sessions, usually in April. If you're interested in getting involved, either as the speaker, moderator, or master of ceremony, please feel free to contact us. And none of these events would be possible without teamwork. Therefore, in these occasions, my appreciations also goes to my colleagues, the board members of the community who have organized this webinar. Finally, I hope that through this webinar, we can learn, share, and discuss together so that all of us can gain the maximum benefit from these sessions. With that, I would like to hand over the sessions to Pak Satria, our moderator, to continue leading the event. Thank you, Bapak Ibu.
Okay, thank you, Mr. Dwi, for the welcoming speech. Okay, so now let's go to the main event, which is the presentation from the first speaker. I would like to introduce the first speaker first, Bapak Ibu. So the first speaker is Dr. Ahmad Kailani. Yeah, is from Universitas Muhammadiyah, and also the background for educational background is from Universitas Pendidikan Indonesia in 2025, and also the interest of the academic interest is English for specific purposes for sure, in particular nursing English. So if you have the same intersection with him, you can have those collaboration. And also he also a peer reviewer for several journals, GIS, Register, and IJLTAL, and so on. And also now he represent the Indonesian education also. Yeah. And the next speaker is Miss Solis. Let me see first. Miss Solis Setiyani. She is a lecturer from Universitas Faletehan, and he comes from the also Universitas Pendidikan Indonesia, the same school with Mr. Kailani, and doing some recent publication on teacher and students interactions, and also for English for nursing, and some about nursing students needs, and book publications about the English for specific purposes, especially for midwifery and nursing, and that's the things that we're going to on the next session, which is for Mr. Kailani. The time is yours. I'll be given the 30 minutes for you to present the material. Thank you.
All right. Thank you very much, Pak Satria, and my friends in ESP, Indonesian ESP community. And salam kenal semua. I'm Kailani from Universitas Muhammadiyah Banjarmasin, and also there are some familiar faces here. Ada Pak Rudi, Pak Dwi Nugroho. Thank you for inviting me to share here. I'm not an expert. I just want to share my just small pieces of my research today. And also I would like to greet Ibu Solis Setiyani. So we are in the same university, UPI ya, UPI Mania. Kawan-kawan here ada Budina juga di sini. She's still struggling for her PhD. And some of my friends from Universitas Muhammadiyah Banjarmasin. Oke, Assalamualaikum warahmatullahi wabarakatuh. Okay, so today I would like to share actually this is our research. It is the latest publication in University Malaysia Sarawak journal. So the title today is The Alignment of OBE, Outcome-Based Education Nursing Curriculum, with the language needs in the health sector in Indonesia. So I just want to make sure that can everyone see my screen? The PowerPoint, does it pop up on your screen?
Yes.
Okay, thank you very much.
Yes, it's here.
Okay, so I have been interested in doing research and also teaching English for nursing since 2010. At the time, I was appointed as the ESP instructor in one of the Muhammadiyah College of Nursing in Kalimantan, in Banjarmasin. And then I have been in love in English for nursing, and then also I did my master still in English for nursing. And Alhamdulillah, I have finished my study and then still in the field of English for nursing. And today, I would like to share just my best practice and then some pieces of my research regarding my research interest, English for nursing. So I would like to outline my presentation today. So it will be touching upon introduction, method, result, discussion, conclusion, and some recommendation regarding the findings. So the introduction of this study, that this is quite trending today, that many health education, they are adopting OBE in nursing. And then this OBE curriculum has been implemented to integrate knowledge, skills, and professional attitudes in nursing. And one of the nursing competencies or skills is a communicator role. So I can say that most of the time, nurse should build a good rapport of communication with the patients. That's why the communicator role is one of the main skill that a nurse should gain during their nursing training. And then this skill require English for clinical interaction, and also they have to be able to document all the nursing cases and problems, and then to some extent also they have to conduct research. And regarding the English for nursing, the previous studies has already explored the integration between general English and workplace communication, but the majority of these studies, they focus on foundational courses like general English. And then that's why non-native English speaking nurses, they encounter some challenges regarding communication barriers in the clinical settings. So based on this rationals and then issues, so I and my friends have been interested to fill the gap, just to fill the limited evidence on the alignment of OBE-based English curriculum with clinical communication requirements and international standard in Indonesian healthcare. So to look at this case, so we adopted the theoretical framework, Tyler rational, and I believe some of you, especially from UP, you are quite familiar with Tyler's rational, to see the alignment between the components of curriculum, and also to look at critically the needs of the students and related stakeholder. I adopted Brown's need analysis framework, which is the quite latest one. Okay, now let's go to the theoretical framework a little bit. So this Tyler rational, it has 4 central questions or 4 central domains. So if we are going to dive into the curriculum analysis, so we have to consider these 4 things. First, the educational purposes or objectives. So we have to make sure that the educational purposes should be aligned with the content of the curriculum, the learning activities, and so on. And then the next one is learning experiences. What is learning experiences? So learning experiences is something that we as a teacher or the school administrator should provide to bring about the attainment of the objective of the targeted curriculum. And then the next one is organization. This is how we design, how we organize all the learning experiences in order to be effectively taught to our students. And then the last one is evaluation. So after we are finishing and completing, or even in our ongoing teaching process, so we need to conduct the evaluation in order to determine whether the purpose are being attained, or is there some challenges or drawbacks during our ESP instruction. Regarding the Brown's need analysis, so this framework, it has 4 main domains. So the first one is democratic perspective. I think if we compare to the Hutchinson Waters and the Dudley Evans concept, still the same, still have intersection, but maybe but Brown's he came up with something new, just try to elaborate the previous theories. First one is about democratic perspective. This related to the learner needs or wants. So using this democratic perspective, I tried to look at the needs of the students, like students and alumni info regarding what they want to learn regarding the course. And then the next one, discrepancy perspective. This is like kind of a comparison between current and desired competence, like examine the gap between what the students' current language competence and then the expected level of language that they need to achieve for their success in their future employment. And then the next one is analytic perspective. This is about the needs or requirement for success or the necessities, like the focus on the objective requirements of the target situation, such as the specific language genres, lexis, and function, especially for nursing. So they need to understand the nursing jargon, the nursing term, the nursing abbreviation, and so on and so forth. And the last one is the diagnostic perspective regarding the barriers to achievement or lacks. So at this stage, we looked at the barrier or constraint that prevent students from achieving their expected competence, such as insufficient instructional time, for example, or inadequate practice opportunities. So based on those issues and then this background, so we formulated 3 research questions. The first research question is, to what extent does the content of the outcome-based English for nursing align with the language needs of the Indonesian healthcare sector? The research question number 2, what specific English communication skills and competence do nursing alumni and nurse managers perceive as essential for effective professional practice in local and international healthcare settings. And then the last one is, to what extent do stakeholders perceive the OBE-based English for nursing curriculum as adequately prepares their student for English mediated communication in their professional nursing context. And then we adopted qualitative case study grounded in constructivist and interpretivist paradigms in the study. And then we invite 7 nursing alumni to be the participant, and then 3 nurse manager from different hospitals in the research settings. And then for the data collection, we use document analysis. So what we analyze were curriculum materials, activities, and assessment like syllabi, curriculum guides, and modules. And then to enrich the data, we confirm the relevance and alignment of the curriculum by inviting the participants in some semi-structured interviews. So this is a glance of the procedures of analysis. So you can see that there are 2 stages here. And then one stage related to the curriculum document analysis, and then after that was followed by thematic analysis. For the thematic analysis, we adopted Brown and Clark 2015 and 2020. So first thing, actually, this is not actually the process is just back and forth. What we found from the curriculum document analysis, we confirm to the participants, and then what we found from the participant narratives and then interviews data. So we try to juxtapose with the curriculum document analysis findings. So the process actually just back and forth. It's not linear like this. So the curriculum document analysis, as I told you before, so we analyze the curriculum documents, the policy documents from the institution, and then for the thematic analysis, so we deep dive and then touch more deeply regarding the result of the document analysis by interviewing the participants. So the sample of interview data analysis. So if you are interested to look at a whole process of the thematic analysis, I would be very happy to share this sample. Just contact me or email me after this. But I just took this excerpt from the sample of data analysis. So we did 3 steps for the data analysis here using Brown and Clark. So first thing first, we do a theme generated. So theme generated. So based on the framework from the Taylor's framework, so we look at the objective. We look at the learning experience. We look at how the curriculum or how the syllabus was organized, and then we look at the assessment which was conducted by the institution in order to see the student achievement, the learning achievement. And after that, the step 2, we broke down the big theme into sub-themes, and then we analyzed the narratives, the commentaries from the participants, and then we classify them. And then after that, we broke down again the sub-theme into we extracted the sub-theme or the example codes, and just to help us to interpret the data more clearly. So then the last step is the reflexive notes. We try to interpret all the findings from the interview. So these are 4 stages were conducted throughout our data analysis procedures. And then based on the data, so we came up with 4 main things. The overall finding, there has been partial alignment with national OBE standards, but significant misalignment with clinical and global communicative demands. So in one side, this curriculum has been aligned with the national OB standard. So what the Nursing Association has required, but to some extent, there have been some still misalignment that need to be addressed for future curriculum development or revisions. Okay, the first one is about the line that this curriculum has been aligned with Indonesia's OB framework and the nursing communicator role. And then, however, there has been overly local and insufficient for international and interdisciplinary communication. So this curriculum focus on the local context. So actually, they need something more interdisciplinary content. And the next one is the topic relevance, like vital sign, like vital sign topic, but largely this topic focus on general and locally oriented. And then the last one is about the lack of nursing specific vocabulary and authentic clinical discourse. So this would weaken the ESP validity. And then based on this finding, that the activities or the learning activities logically sequence regarding the Tyler framework, but still this curriculum need insufficient authentic and TOEFL, even though there has been TOEFL content, but still misaligned with the clinical communication task. And then the practice opportunities still limited. So this issue would hinder the transfer to clinical performance of students. And then the assessment, lack of performance-based rubrics. So performance-based test has been there, but this curriculum needs to provide more clear rubric for that. And also this curriculum need to provide more clinical tasks like patient interviews, handovers, nursing handovers. So this kind of skill have been rarely evaluated in this curriculum. And then maybe this is a very common problem in inadequate time allocation. The institution only provide 2 credits load for this course. Regarding this complexity of the course, for future curriculum development, the institution should provide more credit load for the learning and teaching process. And based on the interview, that a participant need more informal support for their language development like English Day. So and also stakeholder input not included in the curriculum design. So for our recommendation for the next or for future curriculum development, so the institution should include or should hear the voice of stakeholders. And then minimal alumni and nurse manager involvement in the curriculum design. And implication that stakeholders call for nursing specific vocabulary. They also suggest for interactive speaking tasks and small group learning, supporting a shift from language as content to language as clinical practice. And then based on this findings, so we concluded that the outcome-based or OB English for nursing curriculum to some extent aligned with national standard, but still it needs to be aligned with the global nursing market needs. And then the use of or the option of Tyler's and Brown's analysis framework shed light that there has been some misalignment regarding the objective materials and activities assessment. So for the school administrator, they have to make sure that that these 4 things, the objectives, material, activities, and assessment, should be in line one another for their future curriculum development. And then regarding the curriculum content, still remain general, locally oriented, but and then with limited integration of authentic clinical discourse. And regarding the structural constraints, such as limited instructional time, weak performance-based assessment, and minimal stakeholder involvement, so it would reduce curriculum effectiveness. So the school administrator should consider this critical thing for the future curriculum revision. And then the last one, a shift toward an authentic, stakeholder-informed, and a practice-oriented ESP curriculum is important to better prepare nursing graduate for professional communication, I think. Okay. All right, I think that's all from me, and then I would be very happy to respond some question from all the participants, or maybe some comments, or maybe some critics regarding our research, or even maybe those who have the same interest with us, so you can share your best practices. Thank you very much, and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Mr. Kailani, for the insight. Yeah, it's about the alignment of the curriculum, OBE curriculum in nursing, English for nursing. So now we're gonna have the because of the participant is going to be enough for us to have the photo session. Okay, I think we're going to have the photo session first before going to the next speaker. So would you like to open the camera for the photo session? Okay. With the background, yeah, for the Esp Sharing Session, yeah, that has already been shared by the committee. Okay. Okay, so there will be a sign, okay, for me. Already open? What about that, Mr. Dwi? Is it okay for this?
And that's fine, Pak. That's fine.
Okay, so yeah, give it the best smile for the photo. So I'll count on 3. 1, 2, 3. Cheese. Okay. Okay. Wait, Miss Ernie?
One more slide. I'll go to
Oh,
the
one more slide. Okay. The other slide. Let's have a picture. 1, 2, 3. Cheese.
Thank you. All done.
Okay. Thank you, Miss Ernie. Okay. Now let's go back to the second speaker. In this case, I will give the chance to Miss Solis to present the presentation. Thank you.
Thank you so much, Pak Satria Adi Pradana. I'm really grateful to know you in this session. So, Bapak Ibu, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Bismillahirrahmanirrahim. Let me introduce myself, Bapak Ibu. Perhaps this is our first meeting. My name is Solis Setiyani. You can call me Solis. And I work at Universitas Faletehan, Serang, Banten. And from 2014, I started to teach English for nursing in this university. So actually, I'm the junior of Pak Kai. We call him familiar name in our study program. And congratulations, Pak Kai, because you have already finished your doctoral study program. And I really learned so much from him because I also joined his doctoral promotion last year. And I got many insight, many knowledge from his presentation. Bapak Ibu, I'd like to send my biggest gratitude to the board of Indonesian ESP teachers community. Thank you for having me in this warm occasion. Especially to Pak Muhammad Rudi from Universitas Malahayati. She found me. And for the audience also, thank you so much for sharing your time to listening and discuss with us here. I saw some familiar name here, just like my professor. Pak Sutrisno Saji Effendi. He is my professor in Universitas Sultan Ageng Tirtayasa, my bachelor study program. And also Budina Rafidiah, my colleagues, Bu Dwi Solaria, Bu Istiqomah, and also Bu Keti Soraya, and also my students, Ayu Wahyuni. Thank you so much for sharing your time with us here. Okay, so Bapak Ibu, I'm the practitioner of English for nursing teaching. So I'd like to share my experience with you regarding the classroom practice and also the publication of my work, the book entitled Writing for English for Nursing. So let me share my screen, Bapak Ibu, if you don't mind. I'd like to check first. Can you see my screen, Bapak Ibu?
Very good.
What about my voice? Can you listen to me well?
Please, crystal clear.
Okay, thank you. So, Bapak Ibu, in this great occasion, I'd like to share with you about my journey to write English for Nursing 1 and 2. And I just put the title From Classroom Practice to ESP Materials, Reflection on Writing English for Nursing. Before we go to the main issue, I have some questions for you to answer. Okay, Bapak Ibu, I have 3 questions, so we can relate one each other through answering these questions. And let us make it more interactive by going to this web. Bapak Ibu, you can try to join this Mentimeter. And then let us try to answer the questions together. Have you joined the Mentimeter?
On progress, Bu.
Okay. To help you, I also put the link of Mentimeter on the chat box. Okay. If you have joined the Mentimeter, let's try to answer the first question. Do you teach English in a vocational school or a vocational study program, Bapak Ibu? All right. So far, many of you teach ESP in a vocational school or a vocational study program. Okay, 16 responses. Okay. Is there any one of you who want to put your answer? Okay, let us see. So far, the answer, most of you answer yes. So most of us here teach ESP in a vocational school or a vocational study program. So even though the specific issue in this meeting is about English for nursing, perhaps we can relate with other discipline of ESP in this discussion. Okay, I guess it's enough. Thank you so much for your participation in the first question. Now let us move on to the second question, Bapak Ibu. Do you think the learning materials you use sufficiently meet your students' language needs? You can answer yes, no, or not sure. Okay, 17 audiences have already given the answer. And most of you said not sure with the sufficiency of the learning materials to meet the students' language needs. Okay. Thank you so much, Bapak Ibu. I guess more than a half of you gave the responses. Okay, now one more question, Bapak Ibu. I need your participation to answer the third question. It's a kind of open-ended question, so you can type the answer here. In your experience, what makes the available learning materials sufficient or insufficient? Okay, let me repeat the question. In your experience, what makes the available learning materials sufficient or insufficient? One response is already here based on the student's need and level. Okay, the second response, sufficient if it meets to the student's need. Okay, one audience say it is contextually not appropriate. We do not really know what is needed by the students, institution, or industry. Okay. I also ever experienced the same, Bapak or Ibu, in the first year and in the initial years of my teaching in ESP or English for Specific Nurses. I also don't know really much about this discipline. Okay, it's sufficient if relate to the work field, sufficient related to the needs of the study program. Okay, many of you give response based on the student's need, employment need. Oh, right, it's really great. ESP teachers and content teachers collaboration in creating the content. Okay, so we need interdisciplinary collaboration, just like Pak Kai has already delivered. It covers the required skill in accordance with the learning objective. Sufficient if materials match students' need. Materials can be applied in their future workplace. Okay, so professionals' purpose. Insufficient because the institution expectation somehow beyond the limited credit. Right, thank you, Bapak Ibu, for giving the responses to this simple survey. Let me stop this Mentimeter first. And I'd like to go back to my PowerPoint, Bapak Ibu. Okay, so can you see my PowerPoint?
Yes,
Yes,
Pak Solis.
Okay. I began teaching English for nursing in 2014, Bapak Ibu. At that time, I had no background in ESP and no experience in the nursing field. Fortunately, a college introduced me to a book this book titled English for Professional Nurses by Pak Leo Apamudia. That book became my lifeline in the early years of my ESP teaching. Through this book, I found teaching topics, specialized vocabulary, functional expressions, and models of clinical conversations. Gradually, it helped me enter the world of English for nursing. It served as a bridge that guided me step by step toward understanding what nursing students needed to learn. Using this book also meant that I followed the methodological approach embedded in it. The materials combined elements of the grammar translation method, the audio-level method, and communicative language teaching. Students learned topic-related vocabulary and pronunciation, practiced useful expression, listened to clinical dialogues, and completed structured drills. They translated expressions, practiced pronunciation, and eventually created and performed short clinical conversations. From this experience, I learned that the central goal of English for nursing is enabling students to communicate in clinical setting. However, over time, I felt that students needed more than this. To communicate effectively in English, they required greater exposure and more meaningful interaction. I believed they needed the text to read the text related to nursing topics so they could acquire specialized vocabulary in context and develop an implicit understanding of language structure. They also needed to see how communication happens during nursing procedures, not only listen to dialogues. In my view, language learning should extend beyond the classroom through purposeful learning tasks. So about 2 years ago, I conducted a need analysis on nursing students' need in ESP courses, Bapak Ibu. And similarly, just like Pakai found that the nursing students here expected to improve their speaking skills for their professional purposes. In reality, they also need good reading skills because in their real practice, they often need to read the equipment, medical equipment manuals, and also to read the diagnosis. So English is learned to be used. They use English to communicate in clinical practice, and also they need to understand the text that belongs to nursing context. Okay. I gradually
Solis,
yes.
pardon. Can you display it into the wider screen? Just press the button play like that for the PPT.
Pardon, Parodi?
The slide should be in the wider. Oh, can you just press the button play in the slides? Right.
Okay, what about this? Okay, can you see my slide?
Just press
Yes.
the.
We actually can see your slide, but can you please open it wide or the cell?
Oh, okay.
Yeah,
Yes.
thank you.
Okay, so I gradually compiled the materials for nursing through this book. Actually, it's a difficult thing for me because I need couple of years to compose this book started from the pandemic of COVID-19. So for me, thanks to COVID actually, because through this pandemic, I was encouraged to start to write the learning materials for my students. So in this book, there are some contents that I embodied. The first is about nursing or health-related texts. For example, the text about tips of doing therapeutic communication and also good bedside manner, and another text related to nursing and health. And the second content is about nursing or health terminologies, including the pronunciation also. And this is really become my concern actually, because as you know that, okay. Teaching in non-English department, it means that we need more efforts to train our students to be able to use this language well for their professional context. In case of their pronunciation, it needs to be trained more so they can effectively communicate by using English in their discipline. The third context is about functional expression, Bapak Ibu. Okay. What I put on the screen is the functional expressions when they need to assess the pain of the patient, just like asking the location of the pain, the intensity of the pain, and also the pain consistency. After the functional expression, in the book, I also put the clinical dialogue audio. So in providing this clinical dialogue audio, I collaborate with the students. They provide the scenario which I have reviewed, and I also use the technology assistance, Bapak Ibu, to create the dialogue audio by using the CapCut, because this application can transfer the text into the speech. And I also put the content of clinical communication role play on the book, in which the students can get the exemplar of clinical communication practice from another students or from the educators, nursing educators, or the experts of this field. Okay, so what is another crucial thing in teaching English for nursing in specific and English for specific, another English for specific purpose is to understand the intended learning outcome. So just like nursing discipline, they have a strong association, Bapak Ibu. They try to arrange the curriculum well. So anywhere the students study about nursing, they have the standardized curriculum. Understanding the intended learning outcome, it means that we need to read the curriculum of nursing and identify what is expected from the association and also the students when they learn English. In English for nursing case, the curriculum of nursing nowadays mandated that the English course must focus on facilitating students to be an effective communicator who's able to perform therapeutic communication and health education while providing caring. So the pragmatic issue here is therapeutic communication. It means that even though they communicate in EFL context, English for foreign language context, or in global context, they have the same standardized procedure of communication, which is called therapeutic communication, which includes 3 kinds of paces. The first pace is orientation, working pace, and also the termination pace. So as English teacher, we can prepare the students by telling them the useful expression or the functional expression that can be used for each paces. And also, it's not only about the oral communication, but in English for nursing, the context is they do the communication while providing the nursing care. So they must do the action while they do the communication at that time. So when we try to arrange this kind of classroom activities, it can be linguistically and pragmatically relevant to nursing discipline. Bapak Ibu, the book actually lead the students to do role play. Role play is an experiential learning which is believed able to develop the professional clinical communication. And role play is a technique which has been familiar by the nursing community and also nursing educators because it can give the students experience how to conduct the clinical communication in clinical setting. So the definition of role play is a form of workplace-based assessment which configures authentic tasks and context of nursing services in clinical environment. One of the students reflected about having learning activity with role play. He or she said that role play is quite useful for patient services in hospitals, especially for patients who need communication in English. It is indeed quite helpful while in the field. They said that they gain new knowledge and new experiences that we can apply to patient. However, doing role play also has limited condition. It can be too scripted, Bapak Ibu, because the students do the role play with their peer. So actually, when we need the students to be able to communicate in the real field, they need a natural flow, and this kind of natural flow cannot be provided by doing role play. Perhaps we can try to think another technique how the students can have or can be facilitated to practice their natural flow of clinical communication. So I have provided a video of the students doing role play of clinical communication in clinical practice. And if you don't mind, please share 5 minutes to watch this role play video by the students. Okay, Bapak Ibu, the context is the students who did the role play are professional nurse already actually. They already graduated from their diploma 3 nursing, but now they need to continue their education to bachelor degree, and it means that they have required professional experience, but they need to continue their education and they can share their insight regarding with the relevance of doing role play in the classroom and compared it to the nursing field in their real practice.
Good morning. Good morning. I would like to register for medical treatment?
Of course. Your complete name, please?
Setiyani.
How old are you?
I am 30 years old.
Where do you live, Mrs. Dea?
I live in Pradana.
What are you feeling now?
I have had a headache for 2 days.
Alright, please wait for a moment while I register you, okay?
Okay.
Excuse me.
Yes, please come in.
There is a new patient.
May I have the patient identity file?
Here it is.
Alright, thank you.
You are welcome.
Doctor, there is a new patient.
Okay.
Patient dengan dia sakit, please.
Good morning, sir and ma'am.
Good morning, doctor. What is your complaints today?
Doctor, my wife has been complaining of a headache for today.
Alright. How does the pain feel? Is it stabbing or throbbing?
It feels running, doctor.
Okay. On a scale of 0 until 10, with 10 being the worst pain, how would you rate your pain?
It's about 4, doctor.
Is the pain constant?
No, it comes and goes, doctor.
What can relieve the pain?
The face depressed when I rest, doctor.
Are there any other complaints?
I feel weak and dizzy.
Okay, I will check your vital signs.
Okay, doctor.
Okay, I will check your blood pressure first. Please roll on your sleeve belt. Okay, your blood pressure is 152/92, and then I will check your temperature. Okay, now I will check your temperature. Please clamp this in your armpit and wait until you feel it. Okay, your temperature is 36.7 degrees. And then I will check your pulse. Okay, your pulse is 92 times per minute and your respiration rate is 30 times per minute.
How are the results, doctor?
Your wife's blood pressure is high, sir. Is 142/92. This indicates that your wife has hypertension. Is there any history of hypertension in your family?
Yes, doctor. My mother is hypertension.
Alright, I will prescribe medication for you, and then the nurse will explain which foods are allowed and which foods should be avoided to help your blood pressure is under control.
Okay, doctor.
Mrs. Dea, do you have any allergy?
No, nurse.
Mrs. Dea, do you use a medicine called amlodipine to lower your blood pressure? Please take in one a day after meals, okay? Is this the first time you take the medicine, Mrs.?
Yes, nurse.
What food should my wife avoid?
She should avoid salty food and fatty food like fast food, salted fish, red meat or chicken skin. Your wife also manage your health sleep, pardon well, do some exercise like yoga or rowing, belay, and Take a medicine regularly.
All right, thank you.
You're welcome.
So that's the example of role play of clinical communication that was done by professional nurse student because they were in non-regular class. So we cannot meet offline. They need to do the clinical communication practice by making the video. However, for the regular students, I invited them to join the nursing laboratory and conduct the practice directly with Panthem or with their peer to conduct the clinical communication practice. So, Bapak Ibu, this book, the contents of the book try to develop the nursing clinical communication, and the technique of the students doing the practice is by doing the role play in the end of each chapter or each learning outcomes. However, Bapak Ibu, I also identified an ambitious curriculum in diplomatry nursing because in one semester with 2 credits, it is not only the orientation is not only about therapeutic communication, but the association also put the orientation of academic writing and academic presentation in one course. And it's really challenging, and even actually for me, it's kind of impossible thing to be implemented in the classroom to achieve this, not only the therapeutic communication, but also the academic writing and the academic presentation in one course with 2 credits in one semester. So, Bapak Ibu, what are the implications of this journey for writing ESP materials? The implications for writing ESP materials, first, perhaps we can, get a reference to starting writing the ESP materials. And the second implication is we can conduct a need analysis either in the initial of teaching period or as the reflection of our teaching practices. The third implication is that we can try to understand the learning outcomes of the discipline in which we teach the ESP. And the fourth is we can make use of the technological assistance. Even nowadays, we know emerging technologies just like AI. We can try to use these emerging technologies to help us creating the contextualized ESP materials. And the last is we can do collaboration with another ESP teachers or doing collaboration with the educators of the specific discipline and even with the IT or the students themselves. So, Bapak Ibu, in closing, I would like to say that writing English for nursing has never been a perfectly planned academic project for me. It grew slowly from classroom realities, small challenges, trial and error, and also continuous reflection. What I learned from this journey is that ESP material development does not always start from theory. Sometimes it starts from concern for our students, from what we see every day in our classroom, and from our desire to help them communicate better in their future profession. As teachers, we may sometimes feel that we are only teaching, but our classrooms are actually rich spaces of knowledge, observation, and innovation. Our teaching experience is valuable data. When we reflect on it and connect it with ESP principles, it can grow into meaningful materials, even books. I hope this sharing reminds us that we do not have to wait for perfect conditions to start developing materials. We can begin with what we have, what we are, and with whom we teach, and allow the process to guide our learning as educators. To conclude, we can start from our classroom. Thank you very much, Bapak Ibu, for your time, and I look forward to learning from your experiences as well. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Salam.
Okay. Give it applause for Ms. Solis and Mr. Kailani. Okay. Applause online. Okay. So that was the presentations, Bapak Ibu. So it's really interesting. So I would like to ask and of course ask you to ask questions, because now we're going to go to the Q&A sessions. Okay, you can ask directly, or you can chat in the you can message it in the chat box, or you can raise your hand, yeah, to open up the questions directly to the presenters. Okay. So is it for the committee too, right? Okay. Okay. I saw Mr. Rudy has already raised the hand first. Okay. I would like to give the chance to Mr. Rudy, please.
Well, thank you very much for the chance, Satria. A minute. All right. I am interested in both speakers, especially for the need analysis. What I found when I did a need analysis in my classes are the students answer what they want, but they just miss what they need actually. But based on my perception, actually they need to able to write properly, but they just say we want to talk fluently, but actually in the field they do not eat. So what we need to do, especially for creating our materials, two speakers.
Yeah.
And the second question
it seems
is,
like Mr. Rudy is still in awe because of the children. I don't know. Yeah. So it's for Mr. Kailani, yeah, Mr. Rudy.
Yeah, for both. All right.
For both. Okay.
Yeah.
So we're going to keep it up first, or directly answer. What do you want, Mr. Kailani or Ms. Solis? Would you keep the question, or you are going to directly answer the question?
Silakan, Mbak Solis.
Actually, I waited for Pak Kailani to answer first. However, when I conducted the need analysis, I tried to triangulate the data collection, Pak Rudy. It's not only by having the questionnaire, but also by having the interview with some respondents, the representative of the respondents, and also to to observe the classroom practices. So, we can try to translate what they need by by specifically identify what they actually need for their future works. If they, for example, if they answer they want to speak fluently, it means that speaking fluently means they need more vocabularies to be able to speak fluent in their working field. So it means specifically in nursing, it means nursing specific terminologies. And also, you know that Just like I said before, that the pronunciation is really my concern for the non-department English students. Because they need to be improved much in this aspect. So they need also to practice their pronunciation to be able to speak, in English better. And you know that sounds convening. The process of communication in English for specific purpose is meaning making. So if they cannot pronounce well, so they cannot send the meaning of their message well too. Triangulation is the technique that we can apply to get actually the definition of the student's need in ESP, questionnaire, interview, observation, document analysis, perhaps, because the need also has been identified by the association actually. They try to invite the industrial sector, the employees in the work field, the alumni to to make definition of the necessary in the English for specific purpose in the specific discipline. I do hope it can answer, but I believe that Pakai will make the answer perfect. Please, Pakai.
Okay, thank you, Mbak Solis. Actually, it is not a perfect answer, I guess. Just would like to share my experience. Yes, I agree with Ibu Solis, and then I can feel what Pak Rudy has been experiencing now, I guess. Yeah, because maybe you are conducting unit analysis too. Okay, we cannot say that, for example, okay, today I will be conducting my net analysis. That's it, finished. No, we cannot say that. Sometimes we cannot the data as we hope, as we expected, because maybe the participant just say yes or no, or a very short answer, which is hard for us uh, to understand what they are going to address. Yeah, what I did, what I did was I came to visit them and then invite them for separate interviews. Of course, at that time I did some like informal interviews, like have informal chit chat, just to explore more about their needs analysis. It happened to me when I conducted an interview with student participants. Yeah, I can feel you, Pak Rudy. So they just give very short answer. Sometimes misled information. So our responsibility as the researcher, we need to um, elaborate and explain more about our interviews objective. Yeah, and also I agree that we need to triangulate the data. Yeah, instead of conducting interviews, so we can enrich data by observing the document, the policy document, the curriculum, the syllabi, and also we can do some classroom observation. I guess classroom observation would be one of one of the best alternative for you to capture a more real occurrence in your classroom. Yeah, so yeah, it is not an easy task. I must admit that. But again, the process is like back and forth. So once you got the data and then you try to analyze the data and then you find, oh, this is not what I am expecting. So you can double check with your participants about their intention, about their messages regarding the data that you ask your participants about. Yeah, I think that's what can I share with you. Yeah, thank you.
Okay. Is it okay, Mr. Rudy, for the answer? Any
Yes.
follow-up?
Yes, it's really helpful.
Yes, okay. Should be understood. Thank you. So I will scan back to the chat box because there's Mr. Yose Rianugraha already posed a question in the chat box. Would you like to open the mic, or I'm going to read the question here, Mr. Yose? Okay, I'm going to read it. So in your opinion, for both presenters, how might limited instructional time, for example, given at 2 credits in a semester, things like that, reflect broader institutional priorities about language learning in nursing education? That's the question. So I was going to answer first for this.
Can you repeat that again, Pak Satria?
Okay, so how might the limited instructional time, for example, like 2 credits, reflect broader institutional priorities about language learning in nursing education?
Okay, all right. So just 2 credit units not enough, not sufficient for students to build their English for nursing foundation, language foundation. Yeah, as I have found in my doctoral degree study. So I recommend in my dissertation that this institution should have a specific curriculum for English for nursing. So it can start from the very beginning. So and until the end of their program. So it's kind of simultaneously designed with their nursing core curriculum. So 2 credits units is not enough. And then if we compare to the required the National Board of Nursing program, yeah, if I can pick up the term like ambitious curriculum, yeah, from Bu Solis. So this is very ambitious curriculum. So in 1 semester, and then by providing 2 credit units, so they have to throw everything in one plate. Like we have to teach them about academic English. We have to teach them about nursing care reports. We have to make sure that they have to get a very fluent English, and then we have to make sure that they have to do therapeutic communication, nursing therapeutic communication in English. So that's impossible. Yeah, and then we are an ESP teacher. I believe you have the same opinion with me. That's why in my thesis and also to the institution, I proposed them they need to create a more specific ESP English for nursing curriculum, and then this should be simultaneously taught throughout the course program, not only for 2 credit units.
Okay, so that's really straight answer from Mr. Kai.
Yeah.
What about Miss Solis, which also I think agree with that?
Yeah,
Please?
as practitioner, I do agree with Pak Kailani and perhaps all of the ESP teachers here that 2 credits for making or for facilitating our students to be able to communicate well is not enough. As you know, Bapak Ibu, for your information, 2 credits in nursing study program means 1 credit for theory and 1 credit for practice. And the duration of practicing time is longer. It's 170 minutes for each meeting. So in 1 meeting, they will meet with the English teacher for about 220 minutes, even longer than the common 2 credits. However, it's still not enough because of the big size of the class, which consists of more than 30 students. It can be 40 until 50 students in 1 class, and with differentiated need actually, because there is variety of learners in 1 class, so 2 credits is not enough. But previously, in the previous curriculum, English for nursing has more series. If I'm not mistaken, English for nursing, English for nursing 1, English for nursing 2. So they have 3 semester of English. But at that time, because I didn't have much knowledge about how to conduct this class, so the qualification of the teacher also matter. And recently, Bapak Ibu, I conducted a research. I conducted a forum group discussion with the nursing educators, and they also actually aware with this limitness of duration of learning English, because actually they already conscious with the importance of English to make the graduates not only productive in national context but also in global context. And then one of the respondents said that what happened if we embed English into each discipline of nursing? So it's a kind of EMI approach, English as medium instruction, can be also a solution if the institution has vision to make the graduates productive and also empower in global context. That's what can I answer.
Okay, thank you so much. It's really challenging for us as the ESP teachers, because we have to fulfill all the requirements. And yeah, many questions appeared and pop up. Yeah, be ready for Mr. Kailani. And there is also Mr. Dwi who wants to ask directly. Let's give him a chance for questions, please.
Thank you, Pak Satria. And thank you, Bu Solis and Pak Kailani for the interesting presentations anyway. My name is Dwi. I'm in ESP teachers, particularly teaching English for nursing in Universitas Pelita Harapan, Tangerang. And I'm currently doing a PhD in needs analysis in the nursing context. So I really enjoy the presentations and learn a lot, and so many things that I can learn to develop my PhD dissertation. Anyway, I'm using task-based needs analysis to do the needs analysis, and I would like to ask Bu Sulis and also Pak Kailani. So when you did the needs analysis, did you focus on specific nursing units like inpatients or emergency? Probably, as we know that in the nursing context, in the hospital context, they have different units like inpatient department, outpatient department, emergency department, pediatric department, or something. So did you focus on specific nursing units when you did the needs analysis? And in your opinion, it is necessary to prioritize certain units when teaching nursing students, and also language skills like speaking skills or writing skills, something like that. And it's quite related to what Pa Christian Adi has shared. It's about the different contexts, like local or international context. Anyway, like probably different hospitals might have their own standard operating procedures or SOP. How can we ensure that what we teach nursing students still align with industry needs across different hospitals settings? For example, from the video that Bu Solis showed, in particular hospitals, probably they're required to check the patient's identity by scanning the bracelet, or just asking the patients to mention their full name or date of birth. That's in hospital A. Probably in hospital B, the nurses or the nurses are not required to do that. So how can we ensure that what we teach align with the industry needs across different hospitals, all healthcare settings? Thank you, Pak Kailani and Bu Solis. Thank you, Pak Satria, for the opportunity.
Okay. Who's going to answer first? Pak Kailani or Bu Solis?
Kayaknya Pak Kailani mau bergantian.
Oh
Is
yeah.
it true? Oke, izin
Monggo.
Pak Kailani, saya
Oke,
menjawab dulu Pak Kai.
ya silakan Bu Solis. Ya.
Yeah. So thank you so much for your question, Pak Dwi Nugroho. I'm really happy and excited because in this great moment, I can find many practitioners who teach English for nursing because as Pak Rudi said that teaching ESP is a lonely journey sometimes in our institution because we don't have friends to discuss about this issue. Honestly, I want to answer Pak Dwi. I didn't apply specific context for doing the need analysis. The context of English for nursing here, in my case, is English for nursing is given to the students just for about 2 credits. It's quite hard to make it into specific context. So by having 2 credits of English for nursing, I, as the practitioner of ESP teaching, can just give the context of general task in nursing. General task is nursing, however, is quite useful for the professional nurse student because they admitted that the general task is something that we do daily in our practice field. Okay, so with the 2 credits, we can try to, arrange the materials that is really close to their daily activities. However, if we want to conduct the specific issue of nursing, just like pediatric, emergency, and then surgery, surgery issue. So I guess the option that was delivered by one of my participants about having EMI, English as mediated instruction, can be applied. So English is not only learned in one specific course, but it can be embedded into the specific discipline, just like emergency nursing and then surgery nursing and pediatric nursing or maternity nursing and others, Bapak. And it means that we need collaboration between ESP teacher and the nursing educators of the specific discipline. Thank you.
Okay, next, Mr. Kai.
Okay, all right, thank you very much. So regarding the sufficiency of the materials and then the credit units, I agree that 2 credit units is not enough, and then English for nursing is still something broad, right? Because if we are talking about nursing, we have nursing emergency, we have medical surgical nursing, we have psychiatric nursing, and so on and so forth. So in terms of the focus that we have to the focus of the topic, yeah, again, because this is very context dependent. Yeah, needs analysis is context dependent, and then I may say that the needs analysis results that are found in one institution would be different from the result of need analysis conducted by Ibu Solis and my other colleagues here. So that is very context dependent. But still we have the general similarities. Yeah, if we look at the medical English, nursing English, midwifery English, yeah. So we have so this topic or these courses, they have general similarities like taking vital sign, anatomy and physiology of human bodies, and so on and so forth. But when we come to something specific like psychiatric nursing, yeah, I agree with Pak Dwi Nugroho. So we have to provide more credit or more more credit loads to that topic. Yeah. So that's why 2 credit units is not enough for one institution, but this institution they should have locally developed English for nursing curriculum. Yeah, Ya, maybe Bu Solis juga tahu ya. So, from the IPNI or PPNI, the Association Board of Indonesian Nurse Institution, so they have just general curriculum, but the institution, they have the authority to develop the curriculum needs that meet their students' need and then the related stakeholders. That's why if I can recommend this institution, they should have a specific ESP English for nursing curriculum, which is simultaneously designed with the nursing curriculum content. Yeah, would be more specific and then relevant and alignment with the needs of students.
Okay, so that's the answer. Any follow-up questions, Mr. Duino? I think that's all. Yeah. Okay, let's go to the chat box questions. We have question from Miss Lanoke. Miss Okay, that she is curious about Ibu Solis sharing about the reading part. So she agreed that reading skill is important. So she wonders what challenges that Ibu Solis might observe the students have. Thank you. It's directly for Ibu Solis.
Please forgive me. Can you repeat the question, Pak Satria?
Okay.
Because my daughter has
So
just
it is.
came.
So she actually wonders about what challenges that you might observe the students have especially in reading part. In reading part. So that's the questions, the challenges that you might observe of students that doing the reading part, about the reading part that you have already shared.
Okay. All right. Thank you so much for the question, Bulanoke. English for nursing is specific purpose, just like ESP, another ESP courses, Bapak Ibu, and we just experienced it. Actually, it's in the upper level compared to general English. However, often we found that our students actually they don't have a strong fundament in general English. They still has lack of vocabularies when they come to the university level and they have to deal with the specific texts just like nursing. So the challenges is that they need to improve their vocabulary, not only in nursing specific terminologies, but also in general vocabularies. Because to understand the text, it means that they need to have a good fundament to read the specific text. However, they struggle because, yeah, it will be aligned with the achievement of our students in English courses. You know that the TPA score in the English is quite low, so we cannot expect too much to make our students as a good reader in the initial or in the beginning of ESP course. Perhaps we can start with the simple text, 1 paragraph, 2 paragraphs, and we can simplify the text to be able to be comprehended by our students in ESP courses. And again, regarding beside the vocabulary, sometimes I also, not sometimes, I often ask the students to read aloud the text in order to emphasize the vocabulary acquisition, the structure acquisition. However, I often found there is also lack of pronunciation skill in the students. So it means that perhaps they got lack of exposure in English, orally and also written. So we can try to, think about the solution about how to make adaptation of the text for the students in ESP courses to make it or to simplify the text. and also choose the vocabulary that is appropriate with their level.
Okay, Ms. Lanoke. Okay, that's the answer. Okay, now we'll go to another question for Bu Solis. Yeah, Bu Solis again. Yeah, what's role play? Yeah, because you're giving the video about role playing on the part of final assignment. Was it it is a part of final assignment or not? And was it recorded live, like in YouTube, right? Please.
Thank you for the question. This roleplay video was made when the OBE curriculum is implemented, just like the presentation of Pak Kailani. Outcome-based curriculum. So it means that actually to assess the achievement of the students doesn't need to wait for the end of the semester. This role-play video was assigned to the students when all of the materials, the practices of the therapeutic communication has reached the end of the meeting. As I said to you before, Bapak Ibu, in Diploma 3 nursing curriculum, the curriculum is rather ambitious for me because in one semester, it's not only therapeutic communication, but also academic writing and academic presentation, and it's quite impossible to achieve actually. So I divided the meetings into two parts, 8 meetings for therapeutic communication and 8 meetings for academic writing and academic presentation. So this role play was done in the 8th meeting after they were focused to learn about the clinical communication. Okay, so it means that if we think that the students has enough to get the materials and also to practice the clinical communication, then we can assess the student. However, because the role play video that I showed to you is come from the non-regular student, they are professional nurse student, and the system in our institution is that they learn 100% online, so I cannot meet them face to face. So I gave them tasks to make role play video. Not live in YouTube, Bapak Ibu, because it will be really problematic. I ever did the same to, to use the Google meeting or the Zoom meeting, and then they perform the role play live. However, there is technical problem, just like sound, just like lighting and others. So I just gave them tasks to make the role play video. So it means that they can edit the video. However, for the regular student, in which they have 100% offline meeting, on-site meeting. So I invited them to join the nursing laboratory, and they did the clinical communication directly in the nursing laboratory, and I observe their clinical communication practice. Just like that, Ibu.
Okay, thank you. That's the question from Miss Istiqomah Nur Muhammadiyah.
Bu Isti,
the
my
same
friend.
institution with me, yeah. Istiqomah. Okay, so now the question for Pak Kailani, yeah. Just be patient, Mr. Arya. Okay, so this is the question, Mr. Kailani, from Mr. Fatkur Rohkim. So, would you mind elaborating more on the part of overly local, and what does it mean? Is it a weakness or strength for our Indonesian context? Okay, so that's the question, Mr. Kailani.
All right, thank you very much. So that is mean that we have to contextualize the content. So besides teaching the local context of English for nursing, so we need to align the content with the needs of the nursing global market. For example, we need to design the curriculum based on the CFR. yes, curriculum CFR, curriculum of European framework, and also because one of the requirement if you want to be a registered nurse overseas, so you need to pass the test NCLEX, ya, or apa namanya, psikotri ya, NCLEX or like that, NCLEX IELTS. And so we need to prepare the students, and we need to align the contents of the English course, English pronouncing course, with the level of CFR. That's why 2 credit unit is not enough, but we need to provide English pronouncing each semester. Yeah, 2 credits enough for each semester, but we need to build this a language skill throughout their associate degree program or diploma 3, or throughout their BA in English, BA in nursing program. So that's why we need to contextualize. So what we have found so far, so the content of curriculum is really rely on the local context. Yeah, local context. It means that it is still English pronouncing, but still general. Yeah, in terms of the leveling of language proficiency, do not reflect the curriculum at the moment. That's why we need to contextualize the curriculum. We need to integrate the curriculum with the needs of the nursing global market. That's what I mean. That's we have mean, yeah, because I do this research with my colleagues. Thank you.
Okay, so that's what it means by overly local. Yeah. So I think Mr. Ari is already patient enough to ask the questions. So I'll give you the chance to ask the questions, Mr. Ari.
Yeah, thank you very much, Pak Satria, for the time. Probably I will have a question and also a kind of a response, and also a reflective question for all of us, because I'm sure that need analysis is not a new thing for us, right? For the ESP teachers, especially because basically ESP, the core issue is on the need analysis, because it's going to be depend on the needs. But I'm sure also that everybody here also ever been through this. I mean, need analyzing for our classes. However, at the end, sometimes it will be depend on the institution, right? Because the institution will set the goals for the university itself. I've ever been in that situation, meaning to say that teaching for nursing. But in fact, the nurses or the future nurses in Indonesia will be divided into 2 categories, in my opinions. Go to international or in Indonesia. So if you go to the international, definitely 2 credits is not enough. Definitely. But if you go for Indonesia, I do really sure that I'm really sure that it should be still enough for students to master English in the Indonesian or the local context. So the reflexive question is that then what can Indonesian ESP teachers community can do us to kind of communicate or bridge the ESP teachers with the institution, because I do also agree with Ibu Solis that telling about the ESP teacher is actually a lonely teacher. We sometimes work even if the institution is small or it's big, but there is only one teacher in one faculty, for example, then it's going to be very overwhelming. Nobody to talk, and nobody to share. I think this is the part, this part or the gap that maybe Indonesian ESP teachers community can feel it. I'm sure it's going to be another work, but I'm sure that everybody will like work together to answer the question, how can we bridge? I mean, the ESP teachers community can bridge teachers with the institution. And then, oh yeah, by the way, I teach in aviation school right now. And usually the aviation school, always, not always, but most of the time is compared with the medical and also nursing because of the high risk occupational job. So for example, like nurse and also doctor, they will face patient and there is a high risk of the safetyness, talking about safetyness. So that's why in aviation, if they want to go further, becoming like pilot or let's say cabin crew, you have to reach or achieve a certain level of English. For example, pilot, they have to be like C1 in the CFR level. Before reaching C1, they will not get specific words or the ESP materials. They will just go through the general English. So perhaps we also have to reflect ourselves right now. How important is it to set our class becoming an ESP? And I also have a question to Pak Kailani and also Bu Solis. What is your decision, or is it already set by the institution that the English should be ESP, or is it your authority to determine whether your class will be directed to ESP or still in general English? That's my question. Sorry, it's take too long. Thank you very much.
Okay, thank you for Mr. Ari. Okay, so it's going to answer first. I think it's going to be Mr. Kailani, maybe.
All right. Thank you, Pak Teguh, for your reflective commentaries. Yeah, I agree with that. It's kind of like lonely ranger, right? Okay, so needs analysis is still relevant because it is very context dependent, and then what I got from the research setting would be different from what Pak Teguh Ariwibowo have already found in your setting. But if I can say, we can start with something small. So what I'm doing now, so I am building a communication and also collaboration with the nursing teacher in order to improve the curriculum. I mean, okay, the materials. I cannot say curriculum at the moment. It's still the material. Yeah, just to improve, to redesign the materials in order to better meet the needs of students. And then regarding the CFR level, yes, I agree with that. Yeah, it's supposed to be, there is like a foundational program before the student are stepping into this ESP program, because as an ESP lecturer, we know that student needs their background knowledge, right? Like prior knowledge before they are stepping into their subject matter course. Yeah, that's why 2 credit units enough, but for each semester. And then the institution should provide like a foundational program, like 1 or 2 semester, just to equip the student to be able to meet certain levels of language proficiency before they are attending their ESP programs. And then what I'm going to do after completing my PhD in English in ESP for nursing curriculum, so I already disseminated this finding with the management of that school, and then they agree that maybe we cannot make a very drastic changes to the curriculum, because as you know, like Bu Solis, maybe Patugu, they have a very strong curriculum of nursing association, so it's like top and down approach. Maybe it would be hard for us to make significant changes on that curriculum, but we can empower ourselves at the grassroots level. So we need to make sure that ourselves have a capacity to locally develop the materials for student based on the needs, the students' needs. And then after that, of course, we have to continuously promote this the urgency of the ESP to the school administrators, to the policymakers, that ESP is not enough only for one semester course, but we need more. And also, yeah, Pak Solis, me and Pak Teguh and others, so we can do some collaboration after this. So I think more voices would be apa ya? Would be stronger
heard.
messages to the yeah,
Stronger.
would be heard, yeah, to the government, rather than solely conducting research on this field. Yeah, more collaboration would be better, yeah, for our ESP future. Yeah, I think that is my reflective answer, I guess. Thank you.
Okay, Bu Solis.
Yeah. What ESP teachers can do to communicate to our institution so we can try to color the policy. I want to answer, we can do research, Bapak. We can do research so we have data to make our argument strong, and we can disseminate our research result perhaps in some kind of meetings, or we can go approach the managers of the institution and talk about the findings of our research, because that's our, what is it? Researching is already become our soul. We are academician. And whether we have authority or not in our institution, I, as English for nursing teacher, I am so grateful with this association, nursing association, because compared to, for example, English Education Association, this association is stronger. Even they have already arranged the learning outcome to be implemented in each study program of nursing in Indonesia, and even they also has, what is it, has generate the learning outcome into CPMK, capaian pembelajaran mata kuliah. So the authority that they give to the teacher is to arrange or to identify the learning indicator of each meeting, and then what kind of methodology we are going to use in the classroom to achieve the learning indicators, and what kind of assessment can we apply to evaluate the achievement of the students. So actually by stating the learning outcomes, it helped me as ESP teacher who don't deep knowledge in nursing discipline. So I know what focus I need to conduct in the classroom with my students. And it can be also become the inspiration for another discipline which teach English for their specific nurses, just like aviation, Bapak. Is that enough to answer your question, Pak Ari?
Is
Yes,
there any follow-up
thank you
questions?
thank you very much. Yes, it's enough.
Yes, because Mr. Sorry, Mr. Kailani is already leave the room because has to pick up the son, maybe. Yeah. So I think that's all for the Q&A sessions. Yeah, I'm so sorry for those chat box questions that has already been, but it's still what is it? Closely related to the previous questions. And next will be the announcement for the memberships, and also it will be given by the committee. For the committee, please.
Yes, Mas Satria, am I audible?
Yes, Miss Ima.
Yes, hello. Nice meeting you, Mas Satria, our wonderful MC and moderator today, everyone. And Mas Teguh, would you kindly share our membership information poster? Okay, so while we are waiting for Mas Teguh to share what membership informations that I'm going to announce to all of you today, good afternoon, good morning, almost afternoon, I must say, fellow ESP teachers. Assalamualaikum warahmatullahi wabarakatuh. I must say that we do have a lively sharing and discussions today. And of course, we are excited to announce that our registration for batch 7 and new membership of the Indonesian ESP teachers community is now open. So please mark your calendar. The registration period starts from January 31st, which is today, until February 14th. And our committee or our team will start distributing the e-card membership starting from February 22nd until 25th via email. So please make sure you put or you insert your email address when you fill in the Google form. Double check the spellings. Now, what are some of the membership benefits that you will receive by joining us? The first thing first, of course, you will receive 1 year valid membership card, and you will receive free certificate for sharing session event, just like we have today. Networking opportunities, I think I can see lots of fellows here, particularly in nursing, profession. And I'm very happy that some of you can meet in today's events and will hopefully initiate future collaboration. Now, the membership fee is 100,000 rupiah, and you can transfer it via BNI account under the name of Yuyun Putri Mandasari. And I really hope that I think after or during my announcement, Mas Teguh, or I think I will do a little bit later, share the link for the membership. So either you will renew your membership or you are a new member for the ESP, you will need to fill in this registration form. For further information, please visit our website, espindonesia.org. Now, fellow teacher, don't miss out this opportunity to join our vibrant community of ESP teachers and expand your professional network. We look forward to welcoming you as a new member as well as loyal members. Thank you, Mas Satria. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you so much, Miss Ima, for the information. So let's wrap up what happens today to the sharing session 17 that has already been presented by Mr. Kailani and Miss Solis. Okay, so it's actually very good to have this kind of event, and we're going to be really like sharing and caring about what happened in the reality, in the classroom realities that we face, and we need to make some maybe policies later on about what happened in the real life. So it's a good insight, and me myself as the MC and also the moderator, Satria Pradana, would like to give a very gratitude to the members, to the committees, and so on and so forth. Thank you so much. And we're going to meet again in the next session of the sharing session. Thank you. Assalamualaikum warahmatullahi wabarakatuh. See you,
Waalaikumsalam
everyone.
warahmatullahi wabarakatuh.
Thank you very much.
Thank you, Mas Satria. Thank you,
Thank
Mbak
you,
Solis.
Mas
Thank
Satria.
you, Mas Satria. Thank you, Mas Teguh. Thank you, everyone.
Sama-sama. Thank you, everyone.
Thank
Thank
you,
you.
Thank you so
Solis.
much, Bapak
Warahmatullahi wabarakatuh.
Ibu.
Goodbye.
See you.
See you.
Thank you, Bapak Ibu. See you then. Assalamualaikum.
Waalaikumsalam.